Hi, my name is Quemille Benitez, and I'm the Senior Director of Clinical Partnerships at Equip. Equip is an evidence-based eating disorder program that treats all ages and eating disorder diagnoses. It's also fully virtual, which means patients can receive treatment wherever they are. I often get questions about what virtual eating disorder treatment is like. Is it just as effective? How do providers connect with their patients? What does it look like day to day? If you've never experienced it before, it can be hard to picture how virtual treatment can make a real, tangible impact in your day-to-day life. I'm here to share a bit about what you can expect from a virtual program and the unique benefits it can provide. So what does virtual eating disorder treatment look like in practice? At Equip, every patient is matched to a 5-person care team, including a medical provider, therapist, a dietitian, and peer and family mentors who have lived experience with eating disorder recovery. In a typical week of virtual eating disorder treatment, you'd meet with most of these providers once a week via video call at times that fit your schedule. If you're a support person for a patient, you'll be able to join appointments alongside the patient, even if you're not in the same physical space. Because sessions take place at home, patients are often able to implement what they learn directly into their everyday lives. For example, a dietitian might be able to help a patient prep their meals on camera in their actual kitchen. Or a peer mentor might sit with a patient for support while they go through their old clothes. Most virtual eating disorder programs also have virtual support groups that patients and their supports can attend. At Equip, we offer dozens of weekly groups centered on different identities and topics. Because group members join anonymously from across the country, you're able to connect with people with similar experiences you might not otherwise be able to. Plus, you still maintain a sense of privacy. Lastly, virtual treatment is designed to fluctuate with the patient and their needs. As time goes on and the patient starts to be more engaged in their outside life, they might attend fewer sessions per week. The patient is able to keep the same provider team who can help them maintain their progress or step in if they need extra support. So how effective is virtual care? Multiple studies have shown that virtual treatment can be just as effective in treating eating disorders as in-person care. Plus, virtual treatment comes with some additional benefits that are unique to at-home care. Here are a few of the main advantages. Accessibility. In-person treatment centers can be extremely expensive and have long wait lists. Virtual care can help you avoid these obstacles. Equip, for example, has no wait list and is covered by most major insurance providers. Fewer logistical barriers. Virtual treatment allows patients and their families to get care without having to relocate, commute, take time off from work or school, or sit for hours in waiting rooms. It's easier to coordinate multiple schedules since patients and their support people can join from different locations. Specialized providers. Virtual treatment breaks down geographical barriers so that you can access providers experienced and trained in specific diagnosis and evidence-based modalities that might not be available in your local area. Integration into everyday life. Patients are able to stay more connected to all the things in their regular lives that mean the most to them. Virtual care can also help to prevent relapse as patients are already living their normal lives and exposed to everyday triggers while going through treatment. More and more people are exploring virtual alternatives for eating disorder treatment. Not only is it just as effective, virtual care can also have unique benefits, like keeping patients connected to their communities and teaching them to use new coping skills in their everyday lives. If you're interested in learning more about Equip's virtual model, reach out to us for a free consultation. We're here to help.